Oh yes, the other thing that's launching tomorrow is the clinical interest group. So the background is in the document that I've shared a million times and hopefully most of you are aware of, but in brief, it is that we are not big enough to sustain our independent clinical interest group, and we will have more clout, particularly in the MSK world, if we partner with the MACP. So that's the option we've plumped for, having explored a few other potential partners. So let's get these slides to progress. Yeah, here we go. Launch day tomorrow for both of those elements. So like I say, the clinical interest group and the capabilities framework. Firstly, on the clinical interest group, we now have our own website presence. Myself and Carol and Hannah have bashed our brains together to try and decide what kind of documents we want on the website. So we've got an opening gambit of a few bits and pieces, but please, it is your website. Please think about what would be useful to have there, what resources you always go for and can never find on your own computer might be best shared. We'd love there to be some shared documents, business cases, job descriptions, that kind of things, that kind of thing as well. So I'll just give you a quick tour. So when you go onto the main MACP website, which is macpweb.org, if you scroll over to the far left, oh, sorry, I'll just give you a demo of what it looks like up and down there. So it's a well-established website. Some of you may be members. If you scroll over to the right side, it says clinical interest groups, no plural, but at the moment, just the one clinical interest group, which is us. There is a little bit about who we are, why we want to be a clinical interest group, our aims, vision, and values, and a link there to the resources if you want to hit that, or you can just get the capability framework, like I say, from this website. Recommend downloading it on your laptop, PC, something like that, rather than on your phone, because you'll then get the interactive elements of the PDF within that, which we'll look at in a bit. This is the page that's very much under construction. The resources are quite good. It could probably look a bit more user-friendly. The capability framework's at the top of the list there. We've pulled out all the relevant NICE documents with regards to quality standards and clinical guidance there, so they're all easy to find in one place. But this is exciting. The capabilities framework has allowed us to create a suggested national pattern for a job description for, well, this is the Band 5 physio job role. So it's the statements within the capabilities framework pulled out in Band 5 level, or whatever else you want to call it if we're not naming it bands, which it wasn't allowed to be in the main document. Band 6. And we're in the process of writing the Band 6 and the Band 7 and the Band 8. They're a bit more complex because there's so much variability up and down the country of how those levels are applied. So our clinical interest group that I hope you'll all consider yourselves a part of, the aim is to create a network of support, professional development, education, research, influence, and advocating for evidence-based, effective and high-quality physiotherapy practice and care for people living with or who may come to develop a rheumatological condition. Our vision is to improve standards of care, validating, standardizing and advancing the role of the physiotherapist. I like advancing in there. And our values at this point, we've got sharing good practice, supporting each other, maximizing the role of the physio and the MDT, developing individuals, teams and services, networking and being research driven. And I know that Mel Martin got an extra value on there that hasn't made it into there, with apologies if you're here, Mel. It will get on there eventually. Everything's somewhat flexible. So that's our forward-facing aims, visions, values. Within our group and with our relationship with the MACP, these are the bits that we've kind of talked through. So this is across all the potential future clinical interest groups the MACP will work with. So firstly, to define what it is, it's a network that is recognised by the MACP as a group of experts in an area of practice for a specific population. Rheumatology is complex enough that probably we all have days where we don't feel like experts, and I certainly had one yesterday. So it's all relative. I think we are all experts in our own field and our own way, so be proud to wear that badge. The second thing that's quite important from the internal document is the MACP have made it clear there's no formal contract between us and them. Instead, it's a relationship based on an organisational vision and mission for the service users, patients or clients that make up the general population that the physiotherapy profession exists to serve. So it's not a formal contract, it's more of a supportive interrelationship where we each get benefit from each other's things we bring to the table, which for us is the expertise. And for them, I suppose they're bringing us big networks, resources, a website, facilities to run courses and tap into the MSK cohort, as well as better supporting our own rheumatology area. I should say at that point, we are supported by the BSR in this venture, and they're very happy that we've pursued this relationship because the BSR are keen to support us more in a multi-professional forum. So although there is a physio working group with the BSR, their vision of the BSR is not to split things up too much and rather to have whole team education, whole team development across the BSR. So we are very much on board with the BSR's visions whilst having looked at this relationship with the MACP. The final statement, slightly more relevant, is that all members of the Rheumatology Clinical Interest Group must be members of the MACP. It does say there's an allowance for applicants working towards membership of the group to attend one meeting prior to attaining membership. Now, we are meeting this evening on the eve of this group starting, so today's meeting doesn't count because we don't launch until tomorrow. So we've got about 3 more hours of this free meeting period. Not that we're going to meet for 3 hours, but that's the other clever reason of meeting this evening. So how's this going to look? Well, myself and Carol and Hannah have kind of driven this relationship thus far. So we're suggesting the 3 of us co-chair for the initial bit, but primarily we'll be looking at a working group structure. And by calling it working groups, these subgroup meetings aren't official clinical interest group business. So we can do this without getting that affiliate membership whilst we're in a working group structure for a period of months. So 5 different areas, and this is based a little bit on the MACP structure, but also what we've worked through together to think about how we kind of improve rheumatology physio work role and how we care for our patients. So one work group we suggest is education. The next would be professional development and leadership. The next would be the communications group. Then we've got probably quite closely linked membership and engagement group, and then the research group. I'll just expand on what those are. So when we thought about this, education-wise, the MACP are really keen for us to support rheumatology physio-specific education. And we thought of 3 areas within that. We might want to develop some Saturday morning courses or whatever it is that works best for us as members to deliver and to receive. So one of them could be when to suspect inflammatory arthritis and when to refer on, so a more broad training session that we would put together. Another might be interpretation of investigations. So some of us might like to run that, but lots of us might like to learn more in that area. And the third one could be tied into the capabilities framework with regards to the specialism within rheumatology physio and some of those capabilities that are more unique to our role. Second group, professional development leadership. Well, the obvious one today is rolling out that capabilities framework. We're launching it tomorrow, but it's not going to do much if it isn't forced into the hands of the right people so it actually has impact and is used. Professional development wise, like I said, it would be really good to have some sample business cases on our website such that we don't have to reinvent the wheel in all of our separate departments, but can rather piggyback on the amazing business cases and successes our colleagues have. We've started on the job descriptions. It would be nice to have a think about a 7 job description, an 8 job description, perhaps a job description that better covers hydrotherapy type provision, other areas of practice within rheumatology, physio, and the extended or advanced roles as well. And even before we've launched our UK framework, EULAR have been in touch and they're really keen to get us to help them with a profession-specific EULAR's capabilities or compatibility, I can't say it, EULAR's document. So that EULAR did do a generic healthcare professional competency document a couple of years ago, but it's very broad and they're trying to make it a bit more specific. So they were keen to see if some of us might contribute to a EULAR-wide project. So that's 2 groups. Third group, communications. So this is a standard part of all CSP affiliated groups that they have a comms or PRO, public relations officer, which is there to essentially make sure that everyone knows who we are and what we can do. And we've probably been a bit shy on that over the last 13, 14 years since we last had a rheumatology professional network in physiotherapy, in that we need to get our voice heard the CSP and get a bit more interaction there. Membership engagement, so partly trying to make sure that every rheumatology department up and down the country is aware of what we're doing and their physiotherapists can kind of get involved, but also interactions with the MACP, with the CSP, with the BSR and other relevant stakeholders. And then the research group, well, there are some amazing rheumatology research physios already out there and networks around them. So it's just linking into those, but also perhaps creating new ones within that. So I'm just going to stop for a moment and check we haven't got anybody who can't get in. No, good. We are okay from that point of view. And then, so yes, that's the 5 working groups that we would suggest we look at over the next few months together. And it could be you're sat there going, yeah, I want to do all 5 of them. Volunteer me, get me involved. It could be you're sat there going, oh my word, I've had the worst September in record. I cannot take another thing on. I am not saying yes to any of this. And both of those positions are absolutely fine. Everybody's in a different position with what time they can give to this, and there will be variability in that. So if you can't get involved at this stage, perhaps in a couple of years' time, you might be able to then. So really, it's not about making sure that everyone contributes. It's just making sure that the contributions we do collect have meaning and impact. We will come back to that. Whilst you're thinking about volunteering, let's just briefly profile the capabilities framework. So some of you may be downloading it as I speak in further excitement to progress your career, or even reinforce your staffing. We've had a couple of colleagues get in touch and say, you know, we're in a peculiar situation and we are being asked by our managers, do we need as many rheumatology physios as we had pre-pandemic, and can you prove the impact of your staff? So this document has been helpful in supporting current staffing levels where we thought it might be there to create new staff. So both ways it's relevant for that. How the document's set up. So we have 6 sections within it for the capability statements, and it's meant to kind of follow the pathway of the patient here from diagnosis to long-term management. So the screening setting section is there for our FCP triage or interface service colleagues, or perhaps some of us work across those as well. In the orange is what we would do in the actual investigations. So it kind of ties into that screening setting, but also investigations we would do who work with established diagnoses. And then the actual treatment, we split into kind of more traditional physiotherapy type roles, but then also condition management type of work, as well as medication management. And underpinning all of that are your non-clinical capabilities within the document. Why is it important? Well, we think about 20% of appointments in general practice are musculoskeletal. The document's meant to support the whole breadth of that to a degree. So we're looking at first contact roles, private practice, interface triage clinics as well. But the framework is predominantly aimed at the physiotherapist workforce, or the physiotherapy workforce within a rheumatology MDT. Who do we want to read the document? Well, obviously that workforce, including support workers. We want managers to read it. We want clinical commissioners to read it. There's this interesting concept of the ICS that's being rolled out across, I think, England at the moment. I'm not sure if it's other nations of the UK, with apologies to our less English colleagues, but the ICS are each going to have a responsibility for having a rheumatology lead in each ICS. So that person will probably be the clinical commissioner that we best want to interact with, and then you in post in the next few months. So hopefully they'll have enthusiasm for exciting looking documents. Educational commissioners, because there is some talk about kind of educational capabilities within the document. National regulators, well, we've got BSR and CSP to endorse the documents. We're already somewhere there. And then public and patients is going to be interesting. I think we will get feedback probably on Twitter in the next few days from people who've read the document from a public involvement or expert patient point of view, and may want to talk to us about some parts of that. So it's good to release it, but some feedback will be useful from all of those angles. It's a good framework. It fits within other frameworks. So the first contact and advanced practice roadmaps there, the CSP support worker framework. When we started working on this, the CSP said, we'd love to support it, but make sure you go from support worker up to, you know, wherever you want in specialist physio, but we need to have the support worker workforce represented. And that is the official term, support worker, from the CSP lead on that. It could be, you call them assistants or anything else, but support worker is allegedly the correct term. We've linked it into the nurse framework as well, which was released 18 months ago. And as mentioned, there's the generic core competencies for healthcare professionals that EULAR produced within that. So what can you do in the document? You can decide what level you want to assess yourself at, from intermediate support worker, which is kind of band 3, up to consultant at band 8, BCD, I guess, and anything in between there. But we don't use the bands in the document because it's meant to cover lots of different applications of rheumatology physio, which could be in a private provider or kind of arm's length organisation that wouldn't follow Agenda for Change job matching within that. For each of the statements, you can score yourself. And this is Lindsay Burns' work with thanks very much. That you'll need to think about whether you're a 1 in that you haven't achieved the capability statement, you're a 2 in that it's partially achieved, or that a 3 you have fully achieved it. Or of course you can put an N on any of them to say, look, it's not relevant for me, because not all the statements will be relevant for everyone working in rheumatology physio up and down the country. And this is what it looks like. So on the left hand side, this is 2 pages shared at once, excuse the small type, but looking at the arrow there, when you hover over that in the interactive PDF version, you'll be given that chance to choose either number 1, 2, 3, or put an N on there for not applicable. And that's why I'd recommend downloading it on a computer, so you do get that interactive PDF element, which you wouldn't get on your phone if you download it there. It's not, we give an idea of whether the statement is a knowledge or a skill or an attribute, and that was really hard to think about which of them fitted for each statement, so some of them are multiple. And then we tie in the statement from this document to the EULAR rheumatology healthcare professionals competency framework, so how they tie together. If you're wondering why they've gone for competency and why we've gone for capabilities, there's a paragraph on that in the introduction of our document that explains the difference between the two. And basically, competencies are more relevant within a fixed workplace, where the capabilities can be flexible in different workplaces. The final slide to share from the booklet, and this is quite funny because, as I say, Sophie Taylor kindly put these slides together for a different reason and picked out this one. And this was a very slightly controversial couple of pages in the document, because it looks at what you might do to progress from one level to another, which sounds really useful. But the slight issue with that is that this is based on the experience of the 35 of us who were in the development group. So some of these suggestions of indicators or actions are based on what I did 15 years ago or what somebody else did 5 years ago, and they may well not be relevant today. So they're not a glossary of things to do in 2021 or 2022. They're rather an idea of how each of us in the authorship group have progressed. So it would date however we launched this, but it's even more dated before we launched it because some of it's really old stuff, but just to give an idea on there. So we are back to working groups and thinking if there's anything that really takes your interest at this stage. So of those 5, I've whittled on for far too long, haven't I? Apologies. If you want to contact us, we now have a website. The Twitter handle goes live tomorrow morning, and some of you will have had an email from this peculiar Rheum Physio UK person, which is us. And that's our Gmail account as well, if you want to contact us from there. The final thing is we are experimenting with an Instagram account, but none of us have any capabilities with Instagram. So if anybody in the group wants to support that, that would be much appreciated. That's all I've got to say, really. I'll open it to the floor.